Hi everyone, welcome, and we're gonna pierce an ear today. We're gonna start off by assessing the patient's ear. This is not a patient, this is a dummy, so I don't have to take any medical history, but I typically ask BP idya, sugar idya, problem idya anta. Then they say, oh no, nothing doctor, I'm in the pink of health. And then I say, okay, still you need to give me this consent. If I'm going to prick you with a needle, you're going to have to consent. It's a 4-page consent. It is the same consent form for major as well as minor procedures. They're going to sign at the bottom, and that's when we truly begin. Once that is done, I assess the ear, make sure that it is clean. This is a very clean ear. And then I take my surgical skin marker. And then I tell them, okay, how about this piercing here? How about this position here? Okay. And then they say, yes. And then I take another one and say, oh, how about this one here? And then how about this? Today I've decided I'm just going to do 3 ear piercings. So I'm just going to show you these 3 ear piercings. Yay. Okay. And once that's done, I tell them, all right, how about you look in the mirror? So this is a mirror. So I say, oh, look at your ear in the mirror. Do you like this? And they say, yes, we love it. And so then I go ahead and I take a photo. Photo taken. And then, okay, so time to take off my rings. I love my rings. While I'm doing a procedure, I cannot have my rings on. And then I open my gloves. Before I do, I go ahead and I take a bit of cotton and I'm going to put it in this ear canal here. You'll see why shortly. And then I take spirit and I'm going to spray. I'm going to say, oh, this is going to be a bit of a shock. Please don't flinch. And I'm going to spray that ear. And so this cotton is to make sure that none of it goes inside the ear canal, because that can be crazy unpleasant. Then I take my sterile gloves, and for the purposes of this demonstration, it's not going to be very sterile because my staff nurse is actually filming this and I typically need her help to do stuff. But anyhow, we're putting on gloves. Hey ho, love this part of the job. Open up. All right, the alcohol is still evaporating, so we still have time. Okay. And then once my gloves are on, my staff offers me this. What is this? Okay, I'm just going to touch it. Don't judge me right now. This is an insulin syringe. And so what I do is I take the insulin syringe. I mean, they offer it to me in a really sterile way. Oops. Here we go. Open. Oops. Open. Let me put that there. This comes with a superfine needle. Yeah. So we use this, which is LOX 2% plain, that is to say without adrenaline anesthetic. And so we withdraw into this. This is a dummy. There's nowhere for me to actually put the fluid, so I'm just gonna pretend like I'm injecting. Let's say I have only this piercing to do. I'm just going to pierce through this, the bottommost part of the ear loop. Okay. But let's say I have these multiple piercings to do. So I'm going to do one prick, one this way and one that way. And once this area is numbed up, so I've given this way already, right? So once this is numbed up, I'm going to use the numbed up area to go higher up on the ear so that the patient doesn't feel that second prick. And once this is done, I put this insulin syringe carefully away, and you'll see why later. And so now we're all basically prepped up. There's been an alcohol cleaning, but for the second time, my staff nurses will go ahead and clean this ear again. While the anesthetic is acting, I ask them to select from this collection of earrings. This is stainless steel and zirconia. So let's say that this patient has chosen this, and this. We're just going to get that out. All of them have these flat backs so that they don't poke at the back of the ear. I'm going to put this in surgical spirit. Just a pause 1 second. And so actually I forgot this bit, but while they're in the surgical spirit, I have to make sure that these are opened out so that all of it gets soaked in spirit. Okay, so that's that. And so in the meantime, my staff nurse helps me out. She will spray the ear. Yeah, good. And I'll say, no, it won't hurt. Okay, done. And then they're going to offer me this needle. Okay, this is a what gauge is this? 16 gauge. Yeah, this is a 16 gauge 1.5 inch needle. So they open out and they offer me this needle. This is a bigger needle. So this was a really tiny needle, and this is the needle meant for piercing the ear. The trick is to give this particular position properly. So I'm going to select the biggest earring that we have. Mind you, there's a whole towel on and all of that. So let's just assume this is going to be in the strictest aseptic precautions. I hold the ear, I go at the back of the ear, I find a good position which I think could correspond to this. I'm going to pick this up and I come in the bullseye. And once I do that, once this is done, I thread the top of this onto the needle, and then I use the needle as a guide, and there we go. That is one earring in, and then all you have to do is put this flat pack into place. Okay, let's do that one more time because it's so much fun. We're gonna take the second largest earring, again flat packs. Gonna open the flat pack. It's pretty tight, huh? Okay. Now let's say this was the area where we had the marking. That's where the marking is. Going to introduce it from the back at a good point and exit from the front. Remember, the patient is numbed up. They feel no pain. And then okay, yeah, that's how we do a piercing. And then we just thread the flat back here. This is actually the hardest part of a piercing for me, threading this through, because these are so tiny. I did promise you 3 piercings. I'm going to do that third piercing also. Remember, when you're doing a helical piercing, it's not going to be all that easy it's better you use a fresh 16 gauge needle for each piercing. Even if the patient is getting 3, please don't reuse the same stuff. But let's say this is where we intended to. We go from the back to the front, and then so it's up in the front here. I'm gonna thread this through, and ta-da! That is neat. That is lovely. Okay, I'm gonna take that out. How about post-procedural care? We're gonna give them an ointment like this. First, we use gauze, sterile gauze, to pack the ear, especially if they've had 3 piercings. If they've had just 1 piercing, we just wait for the bleeding to stop, and then we give this fradiomycin skin cream to apply twice a day, and then we tell them that you've got to take that earring. This is the earring, right? Please, okay, just gonna place that there. Turn the earring, please, from your cheek outward. So, like this, once a day for the next 2 weeks. So, apply ointment and then turn this towards your cheek. Yeah, towards your cheek, from top to bottom. And then they apply this cream for approximately 7 to 8 days, and then they're good to go. And so that's how you do a nice ear piercing.